Welcome back, fellow mitochondriacs. Today, I'm going to talk about photodynamic therapy. And this is, to be honest with you, a topic that I, didn't necessarily want to cover during this time because I'm trying to do kind of a fairly comprehensive overview of things that can inhibit glucose uptake and glycolysis, as well as lowering blood sugar, so we can handle the glucose side of things. But because we're talking about photobiomodulation, and in particular red light therapy against how it could dovetail into metabolic therapy, whether it be through the use of red light therapy to improve blood glucose to ultimately affect your GKI, or your glucose ketone index, which is a key marker, but also how we can take advantage of red light therapy's ability to basically increase reactive oxygen species, and then within the normal cells, that actually improves mitochondrial function and upregulates certain genes that can improve mitochondrial function. And then for the cancer cells, has an opposite effect. Basically, it will create reactive oxygen species and kind of unlock apoptosis and just lead to cancer cell death through oxidative stress. And hey, Paul from Liverpool, thank you. And what I would say is that even though I want to hit glucose pretty hard over the next several weeks, I think that this is the perfect time to dovetail photodynamic therapy into the discussion, because we're talking about light. And so we might as well talk about kind of other aspects of how light is used and potentially could be used in our endeavors to kill cancer cells. So let me share my screen here, and we will get into it. So we kind of left off on, talking about photobiomodulation and diabetes and prediabetes, insulin resistance, and hyperglycemia, and how much of an effect that could have. But I wanted to go back to a slide that I had presented in the first video that I put out for photobiomodulation. And it was talking about, can PBM or photobiomodulation directly or indirectly kill cancer? And it says that the first involves the direct effect of light on the tumor cells themselves that may be thought to be deliberate use of the biphasic dose response curve to overdose the cancer cells. And then it was saying that this particular tumor type, it was I don't see that it says here what kind of tumor it was, but they used 1,200 joules per centimeter square, which is a very high dose of red light therapy, and it completely regressed the tumors. And I thought that was interesting, because it's kind of dovetail into how photodynamic therapy essentially works and mechanistically. So this paper was published in 2020, and it says here that cancer is one of the greatest life-threatening diseases conventionally treated using chemotherapy and radiotherapy. Photodynamic therapy is a promising approach to eradicate different types of cancers. PDT requires the administration of photosensitizers, or PS, and the photoactivation exerts an anti-cancer effect via apoptosis, necrosis, so that's programmed cell death, that's uncontrolled cell death, necrosis, and the autophagy of cancer cells, or the cell eating, or the self-eating of cancer cells. Recently, various natural compounds that exhibit photosensitizing potentials have been identified. Photoactive substances derived from medicinal plants have been found to be safe in comparison with synthetic compounds, as most of the time when we talk about natural medicine. Many articles have focused on PDT mechanisms and types of PS, or photosensitizers, but limited attention has been given or paid to the phototoxic activities of photocompounds. And in this review, it focuses on common photoactive groups, these furan coumarins, polyacetylenes, trithiophene, curcuminoids or curcumins, alkaloids, and atheroquinones. And I just wanted to use this paper because it had some pretty cool graphics that we can utilize. First of all, as you can see here, the number of publications when it comes to phototherapy or PDT, photodynamic therapy, really started to pick up like kind of in the mid 2010s, and we're seeing a huge spike after 2020. And I think that's promising because hopefully new photosensitive chemicals will be developed and treatment protocols can be developed with that amount of research going into it. It's still not a huge amount. We're talking like it went from basically 0 to, at the most 80, but still it's an 80-fold increase since 2000, basically. So this paper, also same publication, 2022, photoactive herbal compounds and green approach to photodynamic therapy. And it says here that photodynamic therapy is a minimally invasive, alternative, and promising treatment for various diseases, including cancer, actinic keratosis, which is a precancerous lesion of skin, a type of skin cancer called squamous cell carcinoma, Bowden's disease, macular degeneration, and atherosclerotic plaques, aka the plaques that are forming inside of the blood vessels of the heart and or the peripheral vasculature. And PDT involves 3 different components: a photosynthesizer, molecular oxygen, and light. And the photoactivation of administered photosynthesizers using specific wavelengths of light in the presence of molecular oxygen leads to the generation of reactive oxygen species that leads to tumor cell death. And these are just a couple of examples, and this is a graphic that was found in this particular paper. Aloe vera, curcumin, not familiar with this, berberine, and these are the furanocurcumino or coumarins, as well as this other compound. So essentially, what we're dealing with here is we have, this is just like overall photodynamic therapy for cancer, right? So you have some photoactive chemicals, okay? So these are just groupings, like larger groupings of photoactive chemicals, and then you irradiate them with some wavelength of light or some frequency of light, okay? I would say the majority of them are in the visible spectrum, although we'll see that there are papers that do with ultraviolet light as well as infrared light. And you'll have some, like I said, some natural compound or pharmaceutical compound, although they're saying that the natural compounds have less side effects. You radiate it, kind of photoactivates it, and then it has the anti-cancer activity. And this is where we get into like non-linear and linear optics, and I don't have expertise in this area, but I think we can kind of follow this down. So basically, we have a photosensitive molecule, which is at its ground state in terms of energy, and we add energy to the system via the light that it most readily absorbs, and it goes into a high energy state, and it starts to interact with, through electron transfer, various other chemicals that lead to these basically cell death of these cancer cells, but they don't affect the normal cells or have a much less effect on the normal cells. And so this is just like another way of looking at it. You inject or you uptake some plant sensitive or plant-based photosynthesizer, and then it distributes. And what they say is, I don't know if it says it here on this graphic right here, but it particularly, a lot of times these photosensitive molecules will localize in particular organelles, specifically like mitochondria, for example. And then it will also, for whatever reason, it will localize into tumor cells more readily than normal cells, with some compounds. And then because we're all breathing oxygen and we have molecular oxygen around us all the time and inside of us, when we irradiate the person or the tumor site, these can be kind of whole body. This can be local to the tumor, like from the outside, because a lot of these wavelengths actually penetrate the skin and the soft tissue. Or if it's a wavelength that doesn't, then they can even do from inside the body, where like inside of a vessel or inside of a almost like a surgical procedure, is my understanding, where they can put light onto the tumors, and that creates massive amounts of reactive oxygen species, and then leads to tumor destruction and ultimately, hopefully, a healthy patient. And just it's a really neat concept. And it, like I said, it really dovetails nicely into the discussion about red light and just photobiomodulation in general, right? So again, 2022, some natural photosensitizers and their medicinal properties for the use of photodynamic therapy. Despite significant advances in early diagnosis and treatment, cancer is one of the leading causes of death. Photodynamic therapy is a therapy that is a therapy for the treatment of many diseases, including cancer. The use of a combination of a photosensitizer, light irradiation, and appropriate length, aka wavelength or the color of the light, and molecular oxygen. The photodynamic effect kills cancer cells through apoptosis, necrosis, autophagy of cancer cells. And again, this is kind of a very similar abstract that we've seen, just with a newer publication date. And so again, we have molecular oxygen. We're breathing in all the time. It's in our bodies, being distributed throughout our bodies. We have a photosensitive chemical. That photosensitive chemical is reacting and being activated by light. And then the electrons are being excited. They're changing between this like singlet and triplet state. And that then creates reactive oxygen species with the molecular oxygen that we have, which leads to a bunch of different effects. And we're going to talk about those effects. There's these quote unquote type 1 and type 2 reactions. And again, this is like another graphical representation of, basically administration of some photosensitive chemical. It seeds the tumor, and then we shine light on it, and then the tumor regresses because there's massive cancer cell death. So this is probably the most recent, like, large publication for the use of natural photosensitizers in cancer photodynamic therapy. Is published in 2023. It is kind of a Gestalt, I guess you'd call it Gestalt paper. It's an excellent paper. I have like multiple parts of the paper that are actually kind of like, clipped and then highlighted so we can look at some of the key findings and key points to be made. I'm going to try to keep up with some of these questions here. Depth of the target tissue is an important factor. True. Absolutely. Method timing. Absolutely. Tight 24-hour circadian rhythm. Doctor keeping to a tight, not as tight as I'd like to be, especially since I'm going to work tonight. I'm working 3P to 3A. But on the weeks off, I do pretty good. Let's see here. Cool papers. Yes, they are. Novel approach. And yeah, it is beautiful. Question, NAC and glycine, does it grow cancer? Great question. If it was me, I can't give medical advice over the internet here, but what I would say is that I think that NAC and glycine, or GlyNAC, aka, could be a useful tool for preventive medicine. I don't want to demonize anything. Glutathione is our friend when we don't have cancer, but these systems get hijacked by cancer cells. And so if it was me or someone I loved, I would not be giving NAC or glycine supplementally to anyone I know, because I think it would be detrimental. It would likely, at least if you're using a metabolic approach to cancer, it would probably be kind of shooting yourself in the foot. So exploring this paper a little bit further. So photodynamic therapy is regarded as an alternative, low-level invasive approach to cancer treatment based on the generation of reactive oxygen species, ROS, and free radicals at the treatment site. As compared to radiotherapy, chemotherapy, surgery, its side effects are minimal and more tolerable due to selective activation of drugs. In PDT, photodynamic therapy, a particular type of drug, photoactivated, is used, which is only activated to exposure to a very specific wavelength of light in the presence of molecular oxygen, O2, causing it to become toxic to the cancer cell. Without illumination, this is key, the drug is non-toxic for the cells. Thus, this is one of the most appealing features to PDT. A particular type of drug is called a photosensitizer. A PS accumulates for a longer time in cancer compared to a normal cell, which I thought was an interesting point to highlight. These things will particularly accumulate in cancer cells. And then the prolonged retention in the neoplasm region is due to poor lymphatic drainage and increased blood vessel permeability. And it says that there are 3 different intra-related fundamental cell death pathways. I'm gonna have to move this out of the way because in YouTube Studio, I have this like little thing at the bottom, and if I hide it, it will kill my screen. I've learned that much. So it says here that the pathways that kill cancer directly. So there's pathways that kill directly the cancer cell, basically. There's pathways that damage the vasculature or the blood vessels that stop the oxygen supply to cancer cells, and then that activate and stimulate the immune system. So there's kind of multiple mechanisms of how this is proposed to work. So photodynamic therapy is based on a complex coordination of one of the following 3 factors: the specific wavelength of light, oxygen, and a light activating drug, namely a photosensitizer depicted in figure 1, which we'll talk about the photosensitizing drugs, probably to some lesser degree than I will to the natural substances. But it says that PDT fails, photodynamic therapy fails, if any of these 3 factors are missing. So it is a combination approach. You can't just, I'm not saying you can't just give light. We talked about it in the first photobiomodulation, lecture, but light by itself may have an effect on cancer cells through, the mechanisms we talked about on the first slide, even in this lecture. But when we have oxygen, light, and then this drug, we get kind of like superstar effects. And we're kind of taking advantage of the photoelectric effect, is my understanding. And like I said, linear, nonlinear optics. And essentially, well, I think this is actually pretty decent. So like we're shining a photon at the electrons in this nucleus of this atom. And those electrons are being excited or even ejected, depending on the strength of the light. Again, this is not my area of expertise, but I've listened to enough Dr. Cruz lectures to kind of have some clue. So this is, for example, this is actually a slide from from the paper that I'm going over, and you can see this is a very similar. I think it's called a Jablonski diagram. Very similar, where we have basically the photosensitive chemical at a ground state. And then when we hit it with light, it absorbs that energy and it excites these electrons. And then those electrons get converted to reactive oxygen species with the combination of molecular oxygen. And that's when we lead to, basically cell death for these cancer cells. And again, very similar graphic from a different perspective, looking at light, ground state. It's being excited, these electrons, to different either singlet or triplet states. And then that's having the biologic effect of either uncontrolled cell death, controlled cell death, or just shutting down the neovascularization or the creation of new blood vessels to these cancer cells. And one thing I would say is that, we know from Dr. Seyfried's work that these cancer cells don't need oxygen. They are in the Warburg metabolism. They don't require oxygen, but they do require the glucose and glutamine. So, it's kind of a small point, but it mentioned that in this particular, one of these slides was saying that it was, creating the new vasculature was required for oxygen in the cancer cells, probably less important than the actual glucose and glutamine, like Dr. Seyfried's and multiple people have done work on. So, yeah, these are like getting down to like the real nitty gritty of like how the actual photodynamic therapy works. And as much as I would like to read off these slides to you guys and like have you guys have better understanding, I think the pictures really like do it more justice. If you do want to get more into these like mechanistic things, I can go through it. It's pretty fascinating. And but if you're interested, this is the paper. It's from Biomedicine's 2023. It's called The Overview of Potential Natural Photosensitizers and Cancer Photodynamic Therapy. And it really goes a lot in depth into this. And what it says here is that later on in the paper, is it says that in spectroscopy language, basically, a compound that has a stable electronic configuration and has a ground singlet state containing a photo-triggered pi electron is called a photosensitizer. Basically, these have these special kind of molecular configurations that allow the light to have an effect on these particular orbital electrons. And then the photosensitizer, a light-activated drug, is also called a chromophore. You may have heard that term before, chromophore. We have chromophores in our body as well. For example, that's how cytochrome C oxidase absorbs that red light and actually has an effect on the electron transport chain, as well as multiple other chromophores. Water is even a chromophore. That's how red light is absorbed in particular by water and changes the density and changes the coherent domains like we talked about, which has unsaturated conjugated bonds to absorb a specific wavelength of light to become excited. The selection of the photosynthesizer in PDT is a very crucial step. So I'm not going to get into like quantum yields and stuff like that. I think it's above most of our pay grades here, but this is a table of the conventionally approved drugs, quote unquote, for photodynamic therapy in cancer. And some of these you may have heard of, some of you may have not have heard of. I've heard of this ALA, but I have not heard of. I don't think I've heard of anything else. I mean, I've heard of like porphyrins, of course, because that's how you make red blood cells, but and also cytochromes. But I don't know any of these other ones. This is palladium. Looks like a metal. But yeah, I mean, there's a bunch of different photosensitive chemicals that are approved apparently for photodynamic therapy for cancer. It's just that this paper in particular is trying to highlight the natural ones. So we finally get down to the meat of the article where it talks about the herbal photoactive compounds from natural reservoirs. And it says plants contain chromophores also, which have an unsaturated conjugated bond. When light interacts with these molecules, the moietic nature of these chromophores causes a conformational change. The molecule changes configuration. And this review provides an overview of the anti-cancer and phototoxic effects of plant-based natural compounds, which could be isolated from plants. These compounds are, again, these are broken up into groups, but the furanocoumarins, alkaloids, polyacetylines, thiophenes, curcumins, flavonoids, and anthraquinones, and natural extracts. And it breaks it down into basically various sections of this paper. So, for example, this is the section on the furanocoumarins, and there are apparently kind of multiple, I'd say there's two major groups within this group, and these are linear and angular groups. And they give examples of these, like the sorolins, as well as other kind of like other chemicals. And it says that fig extracts, which have high concentrations of furanocoumarins, were analyzed against in vitro melanoma cell lines in conjunction with UV light. So, this particular one, they're using UVA, ultraviolet A. Like I said, most of the photosensitive chemicals that I've seen are generally in the visible wavelength, but in this case, in the case of this family, they are activated with the use of UVA light or ultraviolet A light. And this is just kind of this is the family. This is a graphic that's in the paper, and it's just basically showing what we've seen before. We irradiate these natural compounds, and then we generate reactive oxygen species, which leads to cancer cell death. And there are, I found this table pretty helpful. This actually is another paper, but I kind of, it seems to dovetail nicely right here because it's breaking down the families, probably from the same group. It's breaking down the families. And then I think what's also important is it gives the actual maximum absorbed wavelength. So this 333 wavelength would be UVA, 488 would be blue, 420 to 480 is also blue. Here is UVA again, and this is also blue. So a lot of these that are in this particular paper, I think that things that, and we'll talk about things, but like, for example, curcumin is something that I personally think is one of the rock stars within the anti-cancer, kind of natural compounds. It blocks, glucose uptake, glucose utilization, as well as lowers blood glucose, just generally for like pre-diabetic and diabetics. And then on top of that, it has several effects on the glutaminase, or the glutaminolysis system. So it's like, it's already a rock star by itself. But then on top of that, if we were to add blue light photobiomodulation, and I've seen other places where it actually has some effects in the UV range as well, you can actually employ photodynamic therapy potentially using these molecules, or potentially using these molecules. Pretty awesome. So the next one would be alkaloids. Let's see here. So I just wanted to see what I wanted to highlight here, because a lot of this is like kind of organic chemistry and biochemistry speak that I don't think is going to be very helpful for us. Alkaloids have been reported to have effective properties as an analgesic, neuropharmacologic, local anesthetic, and pain relief. neuropharmacologic, antifungal, antimicrobial, anti-inflammatories, anti-cancer, antifungal, and numerous other activities. And it's saying here that some of these things, some of our chemotherapies are based off of these alkaloids, like for example, vinblastine, and then berberine was also highlighted here. And it says later that there's one alkaloid that, this is where I found it, that it said that UVA light actually had an effect on that one. So although this paper is giving a general picture here of UVA, there may be some of it may vary depending on the type of alkaloid that's being used. And it also talks about like multiple pathways of how they believe that it actually signals through, whether it be the JAK2 STAT1 or some of these other MAPK pathways or BACs, whatnot. This is just kind of, again, biochemical speaking, talking about how the cell death actually occurs. For those who have cancer or want to use, photodynamic therapy, I don't think they per se will care that much about whether it activates caspase-3 or whatnot, but the information is there. I mean, this paper is excellent, and it really lays out a lot of things. So, for example, this is the polyacetylenes and the thiophenes derivatives, and it seems like there's multiple subtypes of those, and they seem to have activity again in the UVA range between 314 border of UVB to 350, which is right in the middle of the UVA. So these, okay, I highlighted this for a particular reason. For example, these compounds show cytotoxic activity in the dark. These compounds showed cytotoxic activity in the dark, but the cytotoxicity was sufficiently increased upon UVA exposure for 30 minutes. So, I think that who was it? It was Daniel Jimenez who mentioned at the very beginning, it's not about this effect that these things actually have photodynamic capabilities. It's about like what's the dose of the photosensitizer? What's the route of administration? What is the what is the wavelength of light, and then how long do you need to actually irradiate these compounds to get the desired effect? And I just think it's interesting because these particular natural chemicals seems to have cytotoxic effect on the cancer cells without being exposed to light. If you remember from kind of like the general things about photosensitive molecules, they ideally don't have any cytotoxic activity in the dark, and then it's only at light. But it seems like these particular ones had some cytotoxic activity in the light, or in the dark as well as the light. Down to coumarin, like I said, are curcuminoids and curcumin. Obviously, it's the yellow pigment within the curcuma family, or the turmeric, plant. And it seems like the absorption varies from 400 to 435, which is kind of like kind of in the violet, beginning to be blue light spectrum. And it said that a research study investigated the combination effect of curcumin with UVB light. Again, we're talking about a much shorter wavelength in the UV range, which is the same wavelength that activates vitamin D. And it says that on human keratinocytes, and found the combination induced apoptosis as compared to UVB or curcumin alone. In addition, UVB irradiation combined with curcumin stimulates the apoptosis of these cells by activating the caspases and cytochrome C release, and multiple mechanisms of how the apoptosis or the programmed cell death is actually happening. But again, even though they're saying that there's maybe the peak absorption is somewhere in the violet to very, very kind of shorter blue wavelength, UVB seems to have also an effect. So it seems like these molecules may have multiple absorption sites where they can be absorbed by multiple frequencies of light. Flavonoids, again, found in vegetables, cereals, herbs, flowers, fruits, seeds, nuts. It's a polyphenolic compounds. And that would include flavonones, flavones, flavonols, isoflavonones, and then anthocyanins, or flavanone and flavanol, and then anthocyanins and these other compounds. And basically what they found was the wavelengths that work best for them was 557. And I'm just thinking out loud here, that's got to be about in the green range. So that this would be a photochemical effect with a green light spectrum. And then some of these other ones, it looks like this genistein, whose absorption was back in the UVA range. So again, it really depends on the compound itself. I mean, I think they try to do a good job here with this particular graphic, like showing families and what the general absorption range is. But it seems that, you know, depending on the subtypes of compounds used within the families, there could be other effects. Like, for example, chrysanthemum has an absorption at 550, and then some of the other ones 360. There's so riboflavin, you know, one of the B vitamins, 360 to 440, which is UVA to in the middle of the blue. And it's talking about using photodynamic therapy for Listeria monocytogenes, which is a bacteria on these smoked salmon fillets. But the bottom line is they can have the photodynamic therapy can be used outside of cancer. It's used for like antimicrobial effects, like it's talking about here. But that doesn't mean that it couldn't be potentially dovetailed into cancer therapy as well, potentially. And then the anthraquinones seem to have, again, this one does a better job of like kind of breaking it down, that this particular compound activates at 410, which is kind of in the violet. This was in the blue, and then this is actually nearing the green. So this is why I would say that, you know, we can't say that it has to be red light therapy, right? It doesn't, you know, red light therapy is a type of photobiomodulation, but photobiomodulation does not necessarily mean red light therapy, even though colloquially within the health community, it does mean that. Obviously, in these papers, a wide range of wavelengths within mostly, again, the visible spectrum, although UVA and B are mentioned in these papers, which are not visible, have an effect on a variety of chemicals. So I think what I would say is that, you know, knowing all of this, especially since, you know, for example, like genistein is used to, you know, help us with multiple areas within metabolic therapy. As a matter of fact, I haven't done a presentation on it per se, but it will come up during the glycolysis inhibitors. Genistein is one of those, and it happens to work with UVA light as well. So, you know, I guess, how do I say this? The benefits of these compounds and the potential benefits of these compounds is so like not yet to be explored, right? Like how, and then for example, like how does metabolic therapy, for example, dovetail into this? You know, that's kind of the more, what do you want to call it? The kind of catchy title I was trying to use for the thumbnail, you know, was like, okay, does this make sense in a vacuum? Like, is photodynamic therapy on an island by itself, or does it make sense to, you know, dovetail this into metabolic therapy? And, you know, these are kind of like I would say, more classical ways of looking at, you know, cancer biology, whether it's, you know, looking at cell cycle and stuff like that. It's not really talking about what could be as relevant, I would say, to us in the metabolic world. But what is extremely relevant to us is this graphic right here, or graphics that are like this that I've shown, and showing how this therapy could easily be dovetailed into metabolic therapy. And the reason I say that is because what is the main goal of metabolic therapy? It's to shut down glucose and glutamine for these cancer cells, right? And when we shut down glucose and glutamine, we are going to shut down, first and foremost, we're going to be shutting down ATP production, we're going to be shutting down lactate production, and we're going to shut down glutathione production. And when we shut down glutathione production, what does that mean? It means that these cancer cells that have glutathione, the shields are down, they're going to be much more sensitive to reactive oxygen species, right? So I personally believe that this would dovetail nicely into metabolic therapy. The question is, how do you employ it? I think that's really where I'm left with, is like, how do we employ these therapies? How can this be used kind of more frequently? The literature seems to be there. It seems to have a profound effect, especially when we start looking at, in the next video, I'm going to particularly talk about methylene blue as being an option for photodynamic therapy. But I want to talk about methylene blue kind of, again, I'm trying to do a deep dive into glycolysis, glucose, like glucose side of the house. But it just seems that these are perfect times for we can dovetail some of these other therapies in. And, methylene blue by itself has an effect, and I'm going to talk about that, but I'm also going to talk about its ability to absorb, particularly red light in the 650, 670 nanometer range and have photodynamic capabilities. And so my point is that I do believe personally that these therapies dovetail nicely into metabolic therapy, because like, being very frank with you, a lot of these chemicals like curcumin, or like a lot of alkaloids, like for example berberine, flavonoids, etc., and other chemicals are, I think, could be big parts of metabolic therapy from looking at from a more of a natural approach, using compounds that lower glucose, glucose uptake. What I mean by glucose is blood glucose, glucose uptake, glucose utilization, like glutamine uptake and glutamine utilization. But then if they have secondary effects where they're able to be photosensitized and specifically kill cancer cells, I think that gives us like a triple whammy, right? So, or maybe even more than a triple whammy, maybe like a quadruple whammy. So I hope that this makes sense. And I hope that, again, I know this is a lot of, like, in some ways, it can be a little bit of like physics and light biology and stuff like that. And I think that we have a lot left to determine to have it all figured out. But the proof of concept is clearly there. And now we just need like kind of more like, trials with humans to really get this ball moving, or in the right direction, how we can start to use these things. And in particular, I think that this is going to have to come from the patient side again, like most things, is that they're going to have to demand the natural photosensitizing chemicals, not the approved drugs. Because again, like some of these papers have shown, these natural products are so much safer than some of these approved drugs. And again, some of these we've seen before, some of these maybe we've not seen before, but it's just an interesting take on how we can use light and how we can use this science to hopefully eradicate tumors in the near future. So I'm going to look through the comments real quickly and see if I can find any particular questions that could be helpful for us here. So. Well, there's always a chance to start your career over again. This is a novel approach, you're right. I heard nicotine patches can be used to reduce GBM. I have actually not looked into nicotine at all. Unfortunately, this is what happens. When you have a substance that's been so demonized because of smoking and the horrible things of smoking, it's almost like you can't get the baby has been thrown out with the bathwater completely, right? Like it's very hard to find like positive studies on nicotine. What I've seen nicotine studies is on cognition and like memory and things like that. A lot of biohackers are using nicotine. I think that I've heard Dr. Cruz talk several times about how nicotine could potentially help complex 1 within the mitochondrial electron transport chain. I cannot understand per se how that works, but I know he's talked about that. I don't. So, do you recommend Tudka over milk? No, I don't personally. I recommend milk thistle generally, just because it has, not only does it have like liver detoxification effects, but it has effects on glucose and glutamine. So I like having triple whammies, because one of the issues that you'll see is that, we've talked about a lot of compounds over the last couple months, right? And it can be pretty overwhelming. When you see, if you were to like do a PubMed search on like, I don't know, 20 different compounds and having an effect on cancer, and you can get lost really easily. So me personally, I like to focus on things that make sense from like, at least for me, it has to at least block glucose or glutamine, ideally both, and ideally multiple sites. Like I think the perfect example I always bring up is quercetin, because quercetin's like the most unbelievable chemical like known. I think it has multiple effects on the things that we definitely want it to have on. So and then on top of that, could there be effects with photodynamic therapy as well? I think that if I'm not mistaken, when we were going through it, I think I did see that quercetin does absorb in the UVA range. It could be blue. Somebody gets an Inferno today. Awesome. Awesome. Ferno or Ferno Pro? Oh, okay. No, I know who this is. Never mind. You have a different screen name. Yep, I see. Steve. Awesome. Methylene blue. Yep. Okay, good deal. Well, if there's no other like questions, I'm going to cut it off. And then what I'll probably plan to do is I'll probably try to have another live stream regarding photodynamic therapy. But I'm going to do an intro to methylene blue first, and then talk about how methylene blue could potentially be used within metabolic therapy and within photodynamic therapy as well. And if you like videos like this, if you like this live stream format, if you like, please share it with people that you know or that potentially could be using this information to help with their health. And until next time. We will talk about beta glucans in a whole entire series on medicinal mushrooms. So they're not going to be talked about probably for a while, at least till we get through the glucose series.